Everyone's very excited too, so let's just jump right in. I have no disclosures, and just to make sure we all have it, the word of the day today is going to be frost. I also wanted to put up this picture and this citation from the book that I use as my primary research for this topic. Throughout the talk, you're going to also see some citations sprinkled along the bottom of the PowerPoint, which are things that I use for supplementation. As an overview for today, we are going to first start off talking about the history of allergy dating all the way back to ancient times. We'll talk about how some of those historical cases led us into understanding of conditions. And then finally, we'll talk about how we've gained understanding of how the environment impacts our atopic conditions, and then also how medications were developed to treat them. Symptoms and clinical conditions of allergy actually existed over 2,000 years ago. They've been around for quite some time. The world back then existed as discrete regions, and in many of these regions, we have documentations of allergic conditions as we know them today. They were treated and even recognized by people who weren't in the medical field. Hippocrates first observed patients and documented symptoms, and of course, we know we have our Hippocratic Oath. We have a number of words that come from Greek origin as they developed through time. Asthma comes from the Greek word to paint, or pantene, and eczema comes from the Greek word to boil. In Mesopotamia, they also had documentations of atopic conditions. They have old cuneiform tablets that outline recommendations for things like cough. And then similarly, they had documentation in Egypt from the papyrus Apers, and that includes a number of different treatments, but one of them that was interesting was that they would use smashed dates to help for treatment of rhinorrhea, which is interesting to me. In Chinese traditional medicine, they had documented quite a few different things, and we'll go a little bit more into specifics on them, but they had a number of conditions that sound very much like what we see in our patients today. As mentioned, we'll talk more about some of these conditions in a few of the slides moving forward. Whenever I look at history or go through history, which I personally really enjoy, I love to think about just who was living back during that time and think about individual people. It really helps me to understand what was going on. Here I highlighted two important people from ancient history. In Egypt, there was a pharaoh who was thought to be one of the very first documented cases of lethal anaphylaxis. You can see here in this picture, which depicts his life and then subsequently death, that on this bottom left-hand corner, there's a little semicircle, and that is a symbol for wasp. So based on what they were able to gather from his history, it seems that he had a wasp sting and then had that a fatal death following that shortly thereafter. In Rome, there were a number of documentations regarding various emperors, and with these two depicted here, you can see that there were signs that they had perennial conjunctivitis, as well as specific horse dander allergy. Later on in the Middle Ages and the Renaissance, universities began to have focuses in medicine, and they were established all across the world. So we have a lot more descriptions of clinical symptoms that align with our allergic conditions today. A Jewish physician wrote a thesis on asthma, in which he recommended at that time already relaxation and personal hygiene for treatment. King Richard III of England was supposedly allergic to strawberries. I will say throughout this talk, because there was so much information, I'm not able to go into a lot of the detail that I would love to on a lot of these. So if you're interested, ask me more, but we do think of him as one of the first people to supposedly be allergic to strawberries. There may be more to the story. Al-Razes gave the first description of rose fever. He described symptoms of nasal congestion, rhinitis, rhinorrhea, and sneezing, which do sound very, very similar to what we know as AR today. In the 19th century, there was characterizations of conditions as we know them now. John Bostic first described hay fever in 1819, and the first study on it was performed in 1873. There were quite a few studies that were performed on animals outlining the development of anaphylaxis after repeat exposures to substances, including things like eggs. We'll go a lot into that more in later slides. And the very first description of asthma came in 1860 by Henry Salter. He described it as a paroxysmal dyspnea with intervals of healthy respiration between attacks. Sounds very similar to how a lot of our patients tell us their asthma presents. In the 19th century, we also began to have an understanding of what occurs in the body on a cellular level, which I think is always very important to know. Thomas Morton Jones gave us the first description of what was very likely eosinophils. He didn't call them those, but they do seem to align with our current descriptions. And Paul Ehrlich is credited with discovering eosinophils and mast cells in the 1870s. Later, of course, we know Charcot and Leyden, they discovered our famous crystals. And I wanted to just include this picture here. I thought it was a really beautiful picture, and this is how they were originally depicted. If you are interested in seeing more photographs and whatnot, that book that I had mentioned has quite a few, and any of the historical sites that you would go through would also have very interesting photographs. As promised, we will begin talking about all of these conditions in more details on the next slide, but here I wanted to show you an overall timeline just to really highlight how quickly this field developed in the 20th century. I tell patients all the time as they ask me questions that our field is really relatively new in medicine, and we are still discovering quite a bit. So even in just the 20th century, we see that in 1900, they had the first patient organization for allergy sufferers. This was in Germany. Soon afterwards, we had the discovery of anaphylactic reactions and coining of the term allergy by Clemens von Parquet. We also had development of immunotherapy and other various treatment modalities, and we gained even more understanding of what underlies these atopic conditions. As promised, I am going to start talking about some of our conditions, and I'm going to start off with discussions of anaphylaxis. This story to me was just so interesting. I know we don't have all the time to talk about every single thing, but I did want to give you details on how this first was evaluated. So here in this picture, you will see on the top Charles Richet and then Paul Portier. And there's some papers here on the right that document their initial evaluations that led to the discovery. At the time that they were doing these evaluations, Charles was a scientist who had interest especially in poisons. To further evaluate things, he went on a scientific cruise with a plan to study how Facilia, particularly, which is the Portuguese man of war, was able to stun its prey, and at that time, a number of soldiers as well. He and Paul Portier worked to determine that there was a paralyzing poison that was in these tentacles of the Portuguese man of war, and they wanted to see if they could inject this into animals to develop a tolerance. When they left the sea, they returned back to France, and they really wanted to continue their studies, but they weren't able to get the Portuguese man of war, so they instead used the actinia, which you see here from sea anemones. In all of their studies, they found that a lot of times injection with this toxin led for animals to be able to tolerate higher amounts of it, but there were some times when injection of this actinotoxin led to a really, really profound reaction, far exceeding what they expected. They had in one study the finding that when they injected 8 dogs, all of the dogs died within minutes of the injection, even though they received a very small dosage of this that they had previously gone through and had no issues with. They remarked astutely that the animals were not immune at this time, but they were instead sensitized, and that the development of that sensitization seemed to correlate with having received the injection before at a prior date without issue. They documented that discovery, and they termed it anaphylaxis, coming from the Greek word aphlaxis, which means protection. Richet later received a Nobel Prize for his discovery, which I think is very well deserved. After anaphylaxis received its name, Sir Henry Dale studied histamine by conducting a number of different animal studies, and histamine was named from the Greek word histos, meaning tissue. In 1903, the Arthur's phenomenon was described, and they actually at that time called it local anaphylaxis because it seemed to be similar to what they had seen before with a prior sensitization leading to development of these symptoms, but it was just more in a localized area. Further studies occurred, including Tom Bald Smith's, in which he would inject animals with bacteria and noted that they developed a hypersensitivity. Of course, there's a lot more detail to this, but we fast forward, and in the 2000s and 2011, the World Allergy Organization released its anaphylaxis guidelines, and of course, today we still continue to broaden our understanding of anaphylactic reactions. The next condition that we're going to discuss now is asthma. I found this to be one of the most interesting histories that I went through, and I hope you enjoy hearing about it too. As I had mentioned before, asthma really has been described for over 2,000 years. It was described in ancient Chinese medicine as a noisy, troubled breathing. And then later, Aulus Cornelius Celsus determined that asthma was one of what he called 3 breathing classifications. It was described as a breathing disturbance without exercise, as opposed to what he termed dyspnea, which was quickened breathing after exercise seen in the majority of people. For treatment of asthma, he very interestingly proposed that the affected sit in an upright position, apply warm wraps to their breast, and also drink a sulfurized wine in which they added powdered lung and liver of foxes. And you can see here on this left picture that was something that they had used to hold the powdered organs. In the Middle Ages, as animal lung powder was still used, but they did also begin to adopt more of the lifestyle changes, including changing bedding for people who had suffered with asthma. We then soon began to understand more of what really caused these troublesome symptoms. In the 18th century, we learned more about the anatomy of bronchi and the lungs. This second picture here is emphysema emboli of the lung of an asthmatic as depicted by their excellent artist. Sir John Florer at that time attributed asthma to a straightness and a constriction of the bronchi, and he had demarcated his recommendations for treatment in text, which is included here. You can see this script. In the 19th century, the neurotic theory of asthma dominated, as we have heard about in prior talks, and we then later had more discoveries. We understood the role of allergens and the role of inflammation in asthma. And we'll talk a lot more about the treatments in the next coming slides after we talk about conditions. So going back to ancient times, the skin eruptions at that time were really viewed more as a way for the body to eliminate toxins. They weren't thought of as something that was really a bad thing. There are precise descriptions of what sound much to be like an infantile eczema, but they once again weren't thought to be very important. Eczema was first defined in 1813, and we do have various descriptions of atopic dermatitis throughout areas and documentation. Ferdinand von Hebra, the head of the beginning school of dermatology in the 19th century, described a lifelong popular disease involving extensor parts of limbs. And then later, Bessener's prurigo was described as a pruritic diathesis onset in infancy. These really now are thought to be the forerunners of atopic dermatitis and are things that people drew from as they were learning more. It was later discovered that this infantile eczema and some of these prurigos were very much the same disease. And as shown in this diagram here, from that period, categorizing their cutaneous reactions, they really came to better understand how things interrelate. This was thought to be a turning point in the history of atopic dermatitis. In the 20th century, of course, we had discoveries in immunology, and this helped to further characterize atopic dermatitis as a special form of hypersensitivity. We have the discovery of filaggrin, of course, and the development of the SCORAD system, which I still use for my patients today, and I know many of you do as well. When learning about allergic contact dermatitis, I discovered that they've been doing evaluations for quite some time. There's been awareness of this since ancient Greek and Egyptian times, but it really wasn't until 1935 that Landsteiner and Jacobs determined the relationship between the chemical structures and development of allergic conjunctivitis. Patch testing, however, had been discovered even before this in 1895 by Joseph Jasson, and Bruno Bloch later expanded on his work, followed by Paul Bonnevie, who then developed the standard allergen series. The true test, as we use it now, was developed by Fisher and Malbach in 1985, and of course, we all are very familiar with that and continue to use it. Rounding out our discussion of the skin conditions, we come to urticaria and angioedema, as everyone knows, something that I personally love to learn about and tell patients about. Based on ancient texts, it was an interest far back in history as well. In the Huangdi Mingjing, which is pictured here on the right side, which was written around 200 BC, urticaria was referred to as Fengyingxing, which means wind-type concealed rash. And that is very similar to what traditional Chinese medicine today calls urticaria, which is Feng Xiao Yingxing, which is wind itch concealed rash. In ancient medical terminology from Latin medical terminology, urticaria was called arido and acera, with arido meaning to burn and acera meaning elevation. Hippocrates also described contact urticaria to nettles, which he named kenosis. And then later, when William Cullen in the 18th century first called urticaria the namesake we follow today, he named it from the stinging nettle, which is also called Urtica urens. Angioedema initially was really first seen as a sign of urticaria, but in 1882, Dinklager and Quink, as we know, described hereditary angioedema. Quink's edema at that time was thought to be of angionotic origin. We know the history there, and we still see that name in medical coding and documentation today. Since we are limited on time today, unfortunately, I won't be able to tell you about all of the conditions that I learned about. So our last condition we'll discuss is going to be food allergy. Hippocrates described the first adverse reactions to cow's milk even prior to 370 BC. Later on, Lucretius, a Roman philosopher, observed that reactions to foods in animals and humans developed in unique individuals, and he remarked, "What is food to one person may be bitter poison to others." There were attempts to evaluate for these food allergies, and Oscar Mennerson, which is here on the left in this picture, was the first to describe scratch testing and the diagnosis of food allergy. There were other evaluations that they had utilized, including measuring pulse rate after ingestion of food to see if there was an increase, and many of the other things that we have learned about throughout our different talks. When IgE was discovered, our ability to evaluate for food allergies really broadened, and we continue to learn more about food allergy now and cross-reactivities. Now that we've talked about some of these really key allergic conditions, I did want to, of course, tell you about how we came to understand how the environment impacts our patients and allergic conditions in general. Of course, whenever we consider the environment here in the Pacific Northwest, we have to consider dust mites. The first observations of dust mites, or mites in general, and their impact came in 1922 when Giacomo and Kana studied mill workers who were suffering from asthma. And he realized, Did someone have a question? I must have heard something.
Sorry. Yeah.
Oh, no worries. So Giacomo and Kana studied mill workers suffering from asthma and realized that the disease was induced by the grain mite Pediculios ventriculosis. Later, Storm Lewin became interested in house dust asthma and suggested that a specific allergen could be responsible for the allergenicity of house dust. He documented improvement of asthma in patients by removing them from dust exposure and then having them return to dust exposure and documenting worsening of their symptoms. A breakthrough came in 1964 when a Dutch group of Voorhuis, Spieksma, and Spieksma-Boesman demonstrated the presence of house dust mites in dust samples. They showed that dust were the main allergen source in that house dust, and they also established that there was clearly more dust, or clearly more mites in the dust from damp houses, and that the allergen content was higher. They studied dust samples collected from various houses with varying humidities to do this. And you can see here on this right side, this bottle is what would have held a mixture of 2 5-gram samples of floor dust collected from vacuum cleaners. As we came to learn more about dust mites, we understood cross-reactivities with crustaceans, mollusks, and now ascaris, and we still recommend these humidity measures and cleaning measures to our patients. While animal allergens, especially from cat, are known to be important allergens now, it really was historically a somewhat controversial idea, which was interesting for me to read about. Horse dandruff was initially a favored allergen source material, but later it was determined that indoor exposure really is the main cause of allergic symptoms for patients. There was, interestingly, this hesitancy to accept that animal mammalian allergens were important, indoor allergens, because at that time they were doing primarily skin testing, and the reactivity from dust extracts without pets was not obviously lower than that of like regular house dust. So they really didn't think that there was anything significant when it came to animal exposures. But as we developed RAS testing, there came this increased awareness of what we really were seeing. RAS tests were able to show that cat allergen contributed to as much IgE binding as dust mite allergen. Soon we had understanding of the main protein families, particularly lipocalins and secretoglobulins, and FeLD1 was discovered to be a major cat allergen. And of course, we have many more that we utilize to help our patients. When the, oh, does someone have a question? Maybe not. So as they were evaluating the environment, there was an awareness that the environment impacted these different atopic conditions. In Japan, a study on hay fever looked at the prevalence related to proximity to cars, and diesel fuel. Similarly, there was an association between exposure to traffic exhaust and higher prevalence of sensitization against pollen in Germany. Diesel exhaust particles and ambient air particles were shown to enhance IgE production in mice, and exposure to carbon ultrafine particles prior to allergen challenge increased the severity of airway inflammation in those mice as well. In vitro studies then revealed that air pollutants induce this type 2 immune response and stimulate secretion of IL-4 and 13 in cell culture, which we, of course, all now talk about and know today. We continue to learn more about the effects of population on human health. Unfortunately, of course, environmental exposures can be hard to avoid, but thankfully, we have a number of treatments available today that we will discuss right now. The first treatment that I want to talk about as a group is catecholamines because they're very important. They're one of the first to be evaluated. In 1860, the British physician and physiologist Henry Hyde Seltzer noted an improvement in asthma in response to what he called a strong mental emotion. You can see his quotation here, but he overall said that a violent emotion can cause a sudden cure of asthma. The search began and adrenaline was discovered in the adrenals in around 1893, 1894. Its effects were first studied in animals, and they were able to determine a lot about what the functions of it were, what it led to in these animal studies. In 1897, John Jacob Abel purified what he called the extraordinary active principle of the adrenal medulla, and he called this epinephrine. Adrenaline, as it's also caused, was initially administered orally, and then in 1903, they used it in asthma, primarily for what they thought would be a vasoconstrictor effect. They hoped that that would improve what they had described previously as this turgidity of the bronchial mucosa. The bronchospasmatic effect of adrenaline wouldn't be discovered until later on in time. It was used initially for asthma as well as hay fever in the early 1900s. And then in 1918, there was a pharmacology guide and it particularly recommended that you could also use a dose of 0.3 cc's administered by hypodermic injection to treat anaphylactic shock. And of course, we still see that, and we still have our patients utilizing it today. After the discovery of epinephrine came the discovery of histamines and the development of antihistamines. In 1910, Henry Dale published his studies on a product of histidine, which would later be called histamine, as we talked about before. Daniel Bovet, pictured here on the right, sought to find something to block histamine, and he performed a number of experiments, once again on animals. In this picture below, you can see one of his experiments. He placed guinea pigs into a box, and then they were administered an aerosolized histamine to evaluate whether or not their body could have an improvement based on different blocking agents that he used. 929F was recognized as the first antihistamine, but Energen was one of the first antihistamines to be introduced clinically in 1942 by Bernard Halpin. We then had development of diphenhydramine, promethazine, and others in that same decade. Ash and Schild then hypothesized that there were multiple histamine receptors, and we came to understand H2, H3, and H4. The chemical structure and activities of first-gen H1 antihistamines was with reduced sedation was then discovered, and of course, the antihistamines were determined to be these inverse agonists rather than receptor antagonists that we utilize in our treatments. Corticosteroids are another widely used treatment with a very interesting history. As we talked about a few slides back, orally administered adrenal gland was used in the early 1900s, and it was thought to be the benefit was thought to come from the glucocorticoid content when we look back today. Edward Kendall discovered glucocorticoids in 1950, and for this, he along with Philip Hench received Nobel Prize in Physiology and Medicine, and they're pictured here on the left and the right respectively. Kendall on the left had isolated several steroids from the adrenal cortex during the 1940s, including cortisone, which they initially called compound E, and then subsequently ACTH, which is isolated from the pituitary gland extracts. Philip Hench on the right was really interested in testing these in patients with rheumatoid arthritis, RA, and cortisone was given to patients in 1948 with RA with very good results. After Hench demonstrated that there was this clinical efficacy of cortisone as well as ACTH in RA patients, John Bordley and ENT showed that ACTH had equally dramatic effects in patients with asthma and allergic rhinitis. Merck & Company first produced cortisone commercially in 1949, but at that time there was some skepticism about the efficacy of cortisol. A medical research council had a trial of cortisone in asthma patients to further evaluate this, and it was the first placebo-controlled trial in asthma. Surprising to a number of people, the results were at that time pretty disappointing, but looking back, this is attributed to them using a very low dose of cortisone, and they also included patients that had COPD along with asthma. Jack Pepys later wanted to further understand whether or not this research was really showing the clinical utility of that cortisone. So he carefully selected patients with asthma and no evidence of COPD. And in those patients, they had a really marked clinical improvement with cortisone use. Becamethasone dipropriate was then found to be effective by inhalation, and they continue to try to utilize inhaled glucocorticoids to reduce the systemic effects of the oral steroids. The beclomethasone dipropionic inhalers were first available in 1972, along with some other inhalers including budesonide and fluticasone propionate. And then later on, there was the addition of LABAs to glucocorticoids, which of course we know went to show that they had a greater significant improvement compared to just increasing the dose of that ICS. And now we have combination inhalers that help a lot of our patients. The last treatment that we'll talk about is immunotherapy. Specific immunotherapy was introduced in 1911 for the treatment of grass pollen-induced hay fever. Leonard Noon believed that the symptoms of hay fever were caused by a toxin in the grass pollen to which only hay fever sufferers were susceptible. With intensive making what actually would have been an antitoxin to what he thought, he initiated treatment with subcutaneous injections of low doses of Timothy pollen extract into patients, which were then gradually increased. By the 1920s, this practice of allergy injections had been extended and included injections from other pollens and animal danders for the treatment of asthma, as well as rhinoconjunctivitis. Franklin and Augustin underwent the first study on immunotherapy, where they treated 200 patients with AR with pre-seasonal injections to one of 4 extracts and then documented their responses. Later on in the mid-1950s, Douglas Johnson performed a study on immunotherapy in children with asthma. And at that time, they did continue to use somewhat more crude and less purified extracts, but in 1962, King and Norman isolated the predominant allergen as short ragweed, and this led to subsequent standardization of extracts being developed, which were utilized more widely. The term immunotherapy was coined in 1958, and after we had that, there continued to be more evaluations. Understanding gradually emerged of the underlying immunologic mechanisms of immunotherapy that include the generation of regulatory T lymphocytes, immune deviation, of course, from that kind of T2 response to T1 response, and then shifting of the allergen antibodies from the IgE to the IgG4, which we all know currently. We continue to explore benefits of immunotherapy with the management of asthma, allergic rhinitis, eczema, and food allergy as well. And I'm realizing that I must have been so excited to tell you all about this as I was talking a little bit faster. So I've reached the end of my presentation a little bit earlier, which gives us lots of time for questions. Once again, the word of the day today is frost. Thank you all for listening. I hope that you found this very interesting as I did when I was researching it. If there are any questions now, I'm happy to talk more. And I can also answer questions you think of later on if you want to email me.
Thanks, Stacey. What did you learn when you were reviewing this about how we develop skin testing, how we got to where we are now, deciding the technique, the methodology, the extracts to use, how we score skin tests, all of that part of it?
Yeah, so the skin testing was really interesting. I wish I could have included some more pictures. Now looking back, I would have had time, which is unfortunate. But when they first were doing skin testing, people really were testing them on themselves. They were going out if they knew they had symptoms and they were testing them on the skin. They did have at that time specific skin testing instruments. I wish I had the picture here to show you, but one that I saw was like a metal device with a handle on it, and at the end they just had the prick, and they would just put it into the solution and they would prick the skin similarly. That for quite some time really was the primary way that they were testing it. So as they evaluated things like dust mite and the different I guess animal danders and whatnot, they were utilizing the skin testing in that way. And then, sorry, Lynn, what was your other question about it?
Well, actually, as I'm thinking, I wonder how people even came to realize that skin testing in the skin had anything to do with things like respiratory symptoms, how they made that connection in the first place. Anybody know that answer? You know, why historically people thought skin testing would be diagnostic for asthma, for example? Anybody have any thoughts on that? People who are...
I would definitely love to hear what everyone's thoughts are as I look back and I think about it. And of course, I did have this in mind when I read it, so it's different. But there was documentation, you know, 2,000 or plus years ago that people's environment, presumably the dust, other exposures to animals and things did cause them to have these worsening symptoms, whether it be these what they called like rose fever, or even the contact urticaria that was described, as well as the breathing issues that were described in kind of various areas. So I think, at least from what I can gather, as they were going through and trying to figure out what could be causing people problems, they really thought that the environment in general was leading to a lot of these conditions. And then as they sought out to look more particularly, that's when they really dove in and said, well, dust clearly bothers people in terms of their breathing, tends to bother them in terms of like their nose and their eyes. And they discovered the dust mites from that, based on that group that I had mentioned. So I don't know if I didn't read at least that there was one particular thing that somebody published or said that said, this is when we start thinking about it. I think it really was more of a general thought that something in the environment was causing it. And then they then proceeded to try to figure out how they could evaluate for that.
For example, I know when in 1911, when Freeman and Noon started immunotherapy, knowing that people got rhino and conjunctivitis symptoms, at one point they would use conjunctival challenge with allergen extracts as an endpoint of therapy. So in other words, challenging the organ where the symptoms were. So
They did,
it
yeah.
still strikes me as, who made the leap from symptoms in your respiratory tract that you could diagnose with testing in your skin. I never thought of that before, but while I was listening to you, that idea came to me.
Yeah, I did. I did see they had actually have really beautiful pictures in that book that I had mentioned of the things that they had trialed, and I didn't include everything in this, but they did have pictures of like conjunctival challenges, and their depictions of how people had, I guess, worsening symptoms of that direct challenge.
Anybody else with questions for Stacey? Another thing that I remember historically, I don't know if you came across this many years ago, before we had obviously purified testing for Hymenoptera allergy, there was a big battle from those who believed whole body extract treatment was efficacious, which we learned it isn't, and actually getting those products taken off of the market. So again, talking historically 30, 40 years ago, did you look into that at all?
So that is something that I have looked at before, but I didn't see it in the book. So if you're looking for that information, I wouldn't go there. But I do recall from, I guess, prior times that I reviewed it, that there was a specific study where they actually injected people with both. I'm not misspeaking on this, but from what I remember, they thought that the whole body extract was similar or maybe even better, and then they had injected people with this to determine their responses. Len, is that what you also have read about before?
Well, the classic study that was done at Hopkins, where they actually took people with anaphylaxis and put them in the ICU, and one group was treated with placebo, one with whole body extract, and then one with purified venom. And they put people in anaphylaxis in the intensive care unit, and they proved that whole body extract was no different than placebo. That was a classic study that Liechtenstein and others at Hopkins did, that was sort of the death knell for those who were advocates of whole body extract, and finally got the FDA to take them off the market. That's a study I'm aware of.
Yeah, that would be the one that I had learned about as well. Glad that I had the right one in mind.
So we have other old people listening who would personally know the history. Dr. Bonatti is out there, I know. Any other anecdotes from those who have seen at least the last 50 years of allergy evolve in front of us?
Not that old, thanks.
I'm glad you're still with us and still participating.
Me too.
Yeah.
Yeah, there definitely was a lot of information. I would say other things that came about more recently, I would say, would be things like latex allergy. There was a lot of interesting information in the book about that. Um, so if anybody has questions about that, we can definitely have a little book club and we can chat about that finding. But they had other things that were a little bit more recent in time. I didn't include those because I think we have some more ideas about that. But yeah, definitely a lot of interesting history. Thank you, Len, for letting me talk about this. I was so excited to be able to talk about history and allergy because I love both. So this was a very fun talk for me to put together.
When you were talking about the development of epinephrine, where'd that word come from? You just sort of said they discovered it and named it epinephrine. And we sort of just accept, I mean, do you know the origin of the word epinephrine, what it means? Anybody who's a linguistic expert?
Sorry, Len, I think were you hearing me just now?
No, I didn't hear you for a minute.
So I'm not sure if this is exactly where he intended it from, but I know that a lot of our words come from more ancient Greek. So when I think about words, I like to kind of look at that. And I know that in ancient Greek, at least, I'm not going to pronounce this correctly, but epi is upon, and nephros is kidney. So upon kidney is from kind of where the word would have come from.
Interesting. I mean, adrenaline I can understand from adrenals. Um,
Yeah,
all
there's
right.
a lot of the interesting words. I know I was trying to kind of sort through things, and some of them made sense to me. The thought processes, for example, for anaphylaxis, with them using aphylaxis, which is protection. I guess in my head, I could see where they were thinking of that, but yeah, it's interesting. I really wish I could go back in time and just chat with some of these major players in the field because they clearly knew a lot, and there's lots of things that we just aren't able to gather from what's documented.
Epi also means above, so it's above the kidney, which is where the adrenal is, and that's where it comes from.
Oh, that makes much more sense.
All
I'm
right.
glad we have a team here.
Any
Well, I'm
more
not
questions
hearing.
for Stacy? We've got 30 other smart people listening.
I'm not hearing any questions, but if anybody digests this lecture and thinks of things that they wanted to message me about, please do. I love talking about this kind of stuff.
I see Angela put something in chat here. We should all congratulate Angela. She's a new mother.
Oh my gosh. Angela, congrats.
Angela, you want to turn your microphone on and say hello?
Sure, Len. Can you hear me okay?
Yes.
I am speaking a little quietly because I have a small toddler and a newborn in the same room, and I'm hoping they will play nicely together for now. But thank you so much, all. I am in the state of recovery, and Aria was born on the 27th at 9 pounds. And so we will take our much needed rest until I return. Thank you so much. And thank you, Stacey, for your presentation.
We need you back tomorrow. You're going to be in the clinic tomorrow?
Actually, I thought about it. I may end up seeing Dr. Coker in clinic tomorrow if he has the time, since she is due for a follow-up visit. So we'll see if he's available to come in and say hi at the Roosevelt Clinic.
That is so amazing. Congratulations, Angela. Oh my goodness. I can't
Thank
wait to see
you.
how cute.
All right, well, we have a very nice community of, one thing that's always been unique about our local allergy community is that we're all friendly and colleagues and collegial, and I'm very happy for that. Any other comments? Nick has wished us all happy holidays in these difficult times in the world. Is there a case presentation to follow by one of the fellows at 8?
Hi, Lynn. Yes, I'll be doing a case presentation, but I think it's a separate Zoom link.
Oh, okay. Do you have that link? I don't think I have it.
I can forward it to you.
Yeah, thank you. All right, so we're gonna do that at 8 o'clock. Wait a few minutes.
Yeah, I would think so.
Yeah, that works for me unless anyone else wanted to start earlier.
I think some people may not be logging in until 8, so yeah, let's do that.
Okay, sounds good. I'll see you all at 8.
Okay, so long, everyone.
All right. Bye, everybody. Thank you so much for joining.